and I'll do my best to educate you about some really interesting new ways that urologists have been approaching BPH, which is just a fancy word for enlargement of the prostate. Let me talk to you a little bit more about myself. I've been in Baltimore for about 5 or 6 years now. Before that, I did my undergrad at Duke University, so for all you University of Maryland fans, don't hold that against me. And then I did my medical training over at Stanford in California, and I practiced urology in Seattle, Washington, and eventually came back to the East Coast. But my training was originally in biomedical engineering. Now, when I was a student and doing my training and my engineering work, I saw these great new devices and technologies being made and used, and ultimately I was just the creator. I was never the end user, and so I decided to go in a field like urology for many reasons, one of which is we use lots of gizmos and gadgets, for lack of a better word. It makes me a little bit of a nerd to my friends, but this is what excites me and excites my profession, and I was going to introduce a new way that technology can approach the very common and pervasive problem of urinary issues from BPH to you all today. Let's start out by just talking about the anatomy, because really that's where it all begins. With regards to your urinary anatomy, you have two kidneys, one on each side, which are the bean-shaped organs which make urine, and the urine flows down tubes called the ureters to your bladder. And that's where all the problem starts when it comes to BPH, because ultimately what needs to happen is the urine needs to flow out of your bladder through your prostate, past a muscle called your sphincter, which holds the urine in place, so when you're walking around, no urine is leaking out, and then through the tip and tube of your penis. And what happens is as you get older, the prostate becomes enlarged. When you're in your 30s and your 40s, this prostate gland is about the size of an ounce, walnut or so forth. And the tube that you pee through is about the size of a milkshake straw. So your bladder squeezes, the channel is open, you completely empty, and you don't have an issue. After the age of about 40, the prostate simply grows. And when it grows larger, the tube that you pee through becomes smaller and smaller. It goes from the size of a milkshake straw to a coffee stirrer. And that's where the problem begins. So the prostate, when you're young, doesn't cause problems. It actually helps you. It helps make babies. It liquefies the semen to fertilize the egg. But after you're past that stage in life, all it does is cause problems. It causes problems urinating, and it causes problems with prostate cancer in some patients, which may have affected some of your loved ones and yourselves. So that's where we start today. We just start talking about the benign enlargement of the prostate, which leads to urinary issues. Now, believe it or not, this is very common. Almost 12 million men in the United States have been diagnosed with this issue of having an enlarged prostate and urinary symptoms related to it. How do we know this? Well, this is where Medicare is a great tool. We can search for all the patients enrolled in Medicare and figure out, based on their diagnosis codes, how many people have it. So that's where that data comes from. And many are diagnosed each year. This is the bread and butter of what we do as urologists. And the treatment, the way we go about treating this has changed significantly, and that's why we're here today. This is a very common problem. If you're above the age of 50, believe it or not, 50% of men have some degree of urinary difficulty. Now this is where men will always be in denial. The women know this very well, is that we'll deny problems until it really becomes at the last stage. But this is a very common problem that affects all of us. And as you get older, as your prostate grows year to year, that tube becomes smaller and smaller. And so the problem becomes even more prevalent. Now, what are the symptoms of this problem? So you walk into a doctor's office, you don't get a diagnosis, you just tell them what's going on. Okay? And so here's the things that we hear from you. Saying, Doc, I'm waking up 2 to 3 nights to go to the bathroom, and now is it affecting my sleep, and how happy I am the next day, and how well I can function? It's affecting my partner. They also tell me to go to the bathroom all the time. I'm trying to go to the Ocean City with my wife. Instead of making 1 or 2 stops, I may be making 4 or 5, and we just don't go to the beach anymore because it annoys the heck out of her. You may say, it takes me forever to go to the bathroom. I'm going to the baseball game, trying to empty my bladder in between innings, but I can't make it back to my seat in time because I'm sitting there in the toilet. It takes me almost a minute to get started. You may be struggling to urinate, maybe grunting. You may notice a stop and start of your stream in the bathroom, and your flow is very weak. You just have kind of a slow dribble. You don't really void with the good stream. And sometimes you may end up having some staining of your underwear even after you pee, you may do your best to shake it out and get it all out, but there may be some drippage afterwards, which is not a dangerous problem, but it's an annoyance, it's a nuisance. And that's what we're talking about today. This is not a sexy field. This is not talking about cancer or making you live any longer or preventing you from having a heart attack. But what gives me enjoyment in my field as a urologist is just to improve your day-to-day life, just to have a better existence. And so none of what I'm telling you today is something you have to do, but if you're struggling with this and want to know more options about how to go about treating it, this is the right place for you. So how do we diagnose this when you come to our office saying, hey doc, I have a problem going to the bathroom? The first thing we'll do is we'll ask you a bunch of questions. We may do a test like looking at your urine sample and making sure there's no blood or infection there. We may do a blood test to make sure you don't have any prostate cancer. That's called a PSA test, unless your primary doctor has done this already. Sometimes we may do some imaging. We may decide to figure out exactly how big your prostate is by using an ultrasound to measure it. We may decide to check how well you empty your bladder. Believe it or not, a lot of men feel like they empty their bladder. They walk into the office and say, doc, everything came out. And when we use an ultrasound machine to see how much is left behind, believe it or not, they may be holding up to half a liter in their bladder, which is not good, and they don't realize it. You don't feel that. But your kidneys do. They may feel some back pressure and get kidney damage from that. You may develop urinary tract infections because you don't empty that urine all the way, and it's like coming back to the toilet after you forget to flush it the next day. It's pretty cloudy and nasty looking. That's what goes on in your bladder if that's the case. You may have a very slow flow of urine, okay? So we can measure this using a special machine to see whether, you're driving a bike or a Maserati when you pee. We can test how strong the flow is. We can measure how big your prostate is, and then there are standardized questionnaires that we've developed across patients of all different ages, ethnicities, languages that have come up a way with a standardized kind of how bad you're feeling these symptoms and how struggle you are in your life because of your enlarged prostate. So whenever you talk about a disease process, you also have a spectrum of treatment options. And I always talk to my patients personally about finding the right balance. It's almost like a seesaw. On one end you have all the benefits, and the other end you have risks. And the benefits definitely have to outweigh the risks. And the easiest thing to do are things that don't involve any procedures or medicines. So we may decide to just have you change your behavior. What's great about that? Doesn't cost anything, doesn't have any side effects, and sometimes produces great results. That's a trifecta. We may tell you that you need to change what you're drinking. Maybe the reason why you're in the bathroom at the stadium is because you had a few beers, or you drink too much coffee or soda, whatever it is. That can certainly make anyone go to the bathroom quite often. We may say, you know what, just watch this for a little bit. You're not too bothered by it. It's not causing any dangerous things that I'm seeing. Or maybe try going to the bathroom more regularly. Instead of waiting till the very last minute, you have to go right away. Try to go to the bathroom on a schedule every 2 to 3 hours. See if that helps you. We may talk about a special exercise called Kegel exercises. And this is where I can see the women in the room nodding their head in recognition. This is what the women do after they give birth to your kids. And they can strengthen the muscles that control and stop and start their flow of urine. So if you are the type of guy that has to go right away, you can use these muscles to give you enough freedom to get to the bathroom in time so you don't have an accident. And these are very simple, easy, no-brainer ways we should at least think about initially. After that, we start talking about medicines. And many of you come from your primary care doctors having taken a medicine already. And the medicines for BPH come in 2 different types. The first medicine is a medicine called an alpha blocker. Common names for an alpha blocker include Flomax or Rapaflo. And what these medicines do is they relax the muscle tone of your prostate. So it takes that coffee stir and releases it to become a milkshake straw. Simple enough medicine to take. You take it once a day for most people, but they have side effects. And the side effects are not always inconsequential. So one side effect is you may get dizzy on the medicine. You may stand up right away and feel a little bit wobbly on your feet. And I've seen plenty of patients in my practice that they may come into the hospital emergency room from falling in the middle of the night. They get up to go to the bathroom in the middle of the night, a little wobbly, they fall, they may hit their head, they may break their hip. All of which, we can conjecture maybe it was their heart, who knows, maybe it was a medicine. But what I can tell you is at the end of that trip to the hospital, their doctors are begging me to say, we can't give this patient this medicine anymore. We got to give him something different. What else do you got? When my wife and I, my wife is an ophthalmologist, so she does a lot of cataract surgery. And when we're not arguing about who's going to do the dishes, we argue about medicine. And what a lot of urologists and patients or primary care doctors don't know is that when you take a medicine like Rapaflo or Flomax, it can make cataract surgery more difficult. Not impossible, but more difficult. And cataracts, believe it or not, are very common. I'm sure many of you have had them repaired. And so those effects of the cataract surgery from the Flomax, they're not completely reversible. So even if you've been on it for a couple of months, it's going to interfere with your surgery to some extent. And it drives my wife nuts. There's another group of medicine that shrinks your prostate. These are a fancy name called 5-alpha reductase inhibitors. And they come by the names of finasteride or dutasteride or Avodart. And what these medicines do is they shrink your prostate. So they make it from a large size and they give it approximately a 30% volume reduction. And so with that medicine, hopefully some people's urinary symptoms can improve. The downside to that medicine is it can cause changes in your ejaculation, which does interfere with men's lives. And it can also cause other bothersome issues, including breast enlargement and so forth. The thing that has become more controversial in urology is someone had the bright idea of using these medicines to shrink the prostate for prostate cancer prevention, saying, well, maybe if we just have the size of the prostate, less people get prostate cancer. But what's become a little bit more evident and still controversial is that if you do develop prostate cancer, you may end up with a higher risk to have prostate cancer, which is why we tend to think twice and why patients think twice about taking these medicines. So what I'm trying to convey here is that medicines aren't as simple or benign as they may seem on paper. Everything has consequences. Next, we move into treatment options. And the treatment options can vary in terms of how rigorous they are to your body and how much risk they pose to your body. And there's various different ways to spread the prostate open with mechanical procedures. And there's other procedures, including laser, which is called the green light or photovaporization of the prostate. And sometimes we use a scraping technique called a TURP. Some patients like to call it the Roto-Rooter operation. And what these procedures often involve is a destructive way or a removal way to take care of prostatic enlargement, to make that channel bigger. These are terms that patients don't like to hear. Things like lasers, or I'm going to burn your prostate, or I'm going to scrape it out. And you can imagine that some of these procedures have more consequences, more side effects, potentially increased risk of blood loss, potentially need to be done in a hospital. And that's where that seesaw balance really comes into play, in terms of weighing the risks and the benefits. Now, the procedure I'm going to describe to you is not in this category. I believe it's more in this category. And the reason why I think it's like that is because it's done in a very controlled, safe setting. And in many ways, it's not meant to be used as an alternative medicine when it fails. It's meant to be used as a way to get relief without taking the medicine. And that's where the paradigm has really changed in terms of how we approach the enlarged prostate. It's a game changer in our field because we're taking medicines away from patients. And when you're 65 years old and you're taking 10 pills a day and you're wondering where do these 10 pills really come from, they come from just the easy and rote kind of technique that doctors use of just adding one medicine after another. And when your medicines have drug interactions and side effects, your primary care doctors are telling us that they're extremely happy when we can offer them procedures like this, which are done in a safe, easy way to get them off of medicines. They take them from 10 pills to 9. And for many patients, that's a huge difference. So Rezum and our mission is to transform your experience, your day-to-day experience. So what is this? This technology is not about lasers or destruction or roto-rootering. It involves using water. So a lot of patients of mine also come in with thinking about natural remedies, holistic remedies, things that they do in China and the Far East, using plants and herbs. This is no different. This involves water. No chemicals. It's not a drug. It's just water. And it's a few drops of water, the same amount in this little perfume bottle. That's all it is. So with the power of a few drops of water, we get this result. And I want to show you a little video here about what this technology does.
Rezum uses the natural energy stored in water vapor, or steam. It is a safe and effective treatment available to relieve symptoms associated with benign prostatic hyperplasia, or BPH. During each 9-second treatment, sterile water vapor is released throughout the targeted prostate tissue. When the steam turns back into water, all the stored energy is released, causing the cells to die. Over time, your body's natural healing response removes the dead cells, shrinking the prostate. With the extra tissue removed, the urethra opens, reducing BPH symptoms. Most patients begin to experience symptom relief in as soon as 2 weeks, and maximum benefit will occur within 3 months.
So what does this do? And what's it intended to do? This is intended to be an alternative to medicines. It's not meant to be as a replacement to medicines when the medicines stop working. This is meant to just give you the option of not taking a medicine every single day for the rest of your life with the side effects, but to give you an alternative so you don't have to get that to get the result that you want. This is meant to provide an improvement in your urinary scores within 2 weeks. So when we did the trials that this got approved on from the FDA, patients were noticing a significant improvement very quickly. So when they filled out the questionnaires between a scale of 1 through 5, how well am I urinating? How often do I go? Those questionnaires improved by 50%, and that improvement was sustained throughout the length of the trial, up to a couple of years. When we measured their flow in terms of how strongly they were urinating, their flow rates were improved for all that time as well. So the objective and symptom measurements were both getting better. This is done as a therapy that we do in the office. It's meant as a form of therapy that we can do without any sort of sedation at all. If you're a person that can tolerate a little bit of discomfort, and you'll hear about that, we can do this under local anesthesia. Now, my job is not to give any bad memories or bad experiences, so I'll tell you that about half of my patients get this done under mild sedation. No different than you'd get when you get a colonoscopy. Okay, so you drift you off to sleep, you're still breathing on your own, so forth, but you don't realize anything that's going on. Many times, this can be done under just a mild pill to make you a little bit more relaxed, like a Valium or something just to take the edge off. So it doesn't require general anesthesia in most cases. And the biggest thing is it preserves your sexual function. Now, what do I mean by that? Not only has there been no change in your ability to get an erection, which means to have a hard enough erection to have penetrative intercourse, but sometimes the medicines that we use for enlarged prostates can change the amount of semen that comes out when you have a climax or an orgasm. And with many men, this is a big issue. It's part of what makes them male. It's part of what enhances their sexual experience. And I always tell men that unless you're trying to have a baby, which most men in their 50s, 60s, and 70s are not, it shouldn't make a functional difference for you, but it does affect your sexual experience, and that's meaningful to a lot of men. And it allows you to get back to your regular activities very quickly. So again, this is not meant to make you live any longer and prevent heart attacks or strokes or anything like that, where you actually have to do this if you don't want to live longer, is what I'll tell my patient if that were the case. This is meant to just improve your day-to-day quality of life. It only makes sense to do something like this if you're going to bounce back pretty quickly also. So what to expect? We often tell patients to expect about 1 to 2 hours of being in the office. The actual procedure time, in terms of delivering the treatment with you on a bed and so forth, takes on the order of minutes, because these treatments are very short. I often leave in a catheter, which is a plastic tube that drains your bladder into a bag, routinely on my patients. And why do I do that? Any sort of surgery causes swelling. If I was a knee doctor, after I did your knee surgery, you'll swell up like an elephant leg. Well, if I do surgery inside of a hollow tube going through your prostate, and the prostate gets swollen, you're going to have some difficulties going to the bathroom immediately afterwards. And just like the swelling of your knee goes away after a few days, so does the swelling of your prostate. And so the catheter prevents that unfortunate experience of not being able to pee when you get home until that swelling comes down. You get a rapid return to normal activities, and we do give you some medicines to make you more comfortable, to have a better experience and an enjoyable experience. So this is a patient testimonial. This is a patient that's an actual patient. He's not an actor. He's gone to treatment, and he just wants to communicate to you all what his experience was like.
You need to know where every bathroom is within a 5-mile radius of wherever you are. You know, I remember there was a time when we were in Spain and the people we were traveling with were saying, you know, he's always going to find the bathroom. And I always had to. I had pretty well was resigned to the fact that I would have to take medication forever. Well, first of all, it was really expensive. You know, even though I have Medicare Part D, it still was an expensive thing. Plus, you know, it makes you dizzy, and I'm not so sure I wanted all of that stuff in my body. And so then I made an appointment and said, you know, I've read your brochure and I'd like to consider this. So had a conference with the physician, and you know, he didn't push me at all. He said, you know, I want you to think about this. And so, you know, I did that, went home. I talked about it with my wife, and I said, I don't see where this is going to lay me up. You know, this should be something that's going to work really pretty well for me. And so I went back to the doctor, made an appointment, and you know, I don't think I was at the clinic for more than an hour. It didn't hurt. It felt weird, but it didn't hurt. I first started feeling relief from the symptoms probably 3 weeks after the surgery, because I had to gradually get off of the Flomax and start taking those pills every other day because you just can't stop with those for 2 weeks. And the Avodart, my urologist said, take it until it's gone. So when it was gone, I was free. Since my Rezum procedure, I've been able to be free of having to know where the bathroom is right away. I don't have to take pills, and I don't have to pay for them. When I do get up at night, which is about once a night, and I think that's pretty normal, I'm not dizzy. I don't feel like I have to hold on to something. It just kind of really works beautifully. And there have been no side effects. My God, to have the freedom. This is really what has been the end result, is freedom. Freedom is a big thing. I would really say this sets you free. And when you're 75, like I am, that becomes a really important issue. I would say to my friends, and have, about the procedure, it's easy. And if you're thinking about it, do it. It gives you the freedom that you never thought you would have again.
That's meant to be as a very honest, hard-spoken experience for a patient that is pretty typical, to be honest with you. And that means a lot. To conclude here, you know, the right patient for this procedure is someone who is simply tired. Tired of having the symptoms of an enlarged prostate. Tired of feeling like they have to take a medicine to improve their lives, to have to deal with side effects of a medicine, or to take that extra pill on top of the 9 that they take already for their heart, their diabetes, or cholesterol. And patients who are motivated to take that next step, to give them more freedom and a more durable result from just a nuisance of a problem. Again, this is not about making you live longer. This is not about heart disease and so forth. This is just about your day-to-day existence and quality of life. And it only makes sense if that cost-benefit seesaw of a balance really makes sense. It really has to be a quick, efficient, low-risk procedure to give you that benefit you would incur from it. And so if you're dissatisfied with some of the other treatments that your doctors have talked to you about, like lasers and scraping or the Roto-Rooter, and you're looking for a simpler, more holistic in some ways, more benign procedure that just uses water vapor, this may be the right choice for you. The best way to go about figuring out if this is the right choice for you is to make an appointment to speak with a urologist that has experience in this, and has got experience in just surgical or minimally invasive management of an enlarged prostate altogether. And there are a group of doctors that have dedicated their training and their careers just to this topic. And what you may find is that as you go through the evaluation process, They may say, you know what, the answer for you seems more like you just need to change your dietary habits. And if you stop drinking 8 cups of coffee a day, that may do it for you. That'll be great. Or they may say to you, we found something more serious instead. We found some blood in your urine, or we're concerned about the idea of prostate cancer as you go through the workup. But ultimately, if you go through the testing and it confirms that you are a good candidate for this procedure, I think it really makes sense for the educated and motivated patient that is interested in avoiding chronic medical therapy. I appreciate everyone's time. I really hope that you provide some answers and good education, and thank you again.